Here with my dear friend and pregnant mama with twins, Sam here, and we're going to be doing some adjustments today. She is now, how many weeks pregnant?
36 today.
36 today with twins. And right now her babies are presenting what we call a transverse and breech presentation. So we're going to be utilizing some techniques specialized for pregnancy called the Webster technique, as well as some more traditional chiropractic adjustments and soft tissue work in order to try to balance out her pelvis, release some tension around the belly, and see if we can get everything nice and balanced so that those babies want to shift around and go into that position to come and enter this world with us.
That is what I need, yes.
Yes, awesome. So let's get to work. We're gonna have you lie on the table here. So we have some pregnancy pillows that give some nice space for baby. So I'm gonna have you kind of climb onto the table here. Place your belly right in the center. Does that feel comfortable there? Comfortable as we can be. And then, does that feel pretty good there?
Yeah.
Good. Okay, so first we're just gonna check in with mama here, see how everything's feeling, kind of observe how she's laying. Right, and we're gonna help your mommy, right, Azzy? And we're gonna do a little bit of a hypervolt massage first, just to loosen up the muscles, send a little bit of vibration into the body,
Oh, yeah, no problem.
start to allow everything to loosen up. Does that feel okay?
Yeah.
And it's always good to have big sisters helping. She already knows all the moves. So it's important that not only are we focusing on mama's belly and pelvis, but we're looking at her entire spine and body, because her weight over the last few months has been shifting in all sorts of different directions as babies grow and her belly gets bigger. So not only is there weight directly on the low back here, but just the center of gravity starts to change. So it's important to look up and down the spine to make sure that the entire body's nice and balanced.
Boys are on the move.
They're on the move? That's what we want.
They're awake.
And it's really common during and after adjustments to feel baby or babies move around quite a bit because their home now is a little bit more balanced and we got some movement in there, so they like to have a party afterwards, which is always fun to feel. So working into the glutes here, because those tend to get really tight and can also start to pull and shift on the spine and pelvis. Just releasing some of the muscles into this area as well. You're such a good helper. Thank you. Are you excited for your babies? Yeah, you're gonna be such a great big sister. These muscles of the low back start to get really tense as well. Doing good with this pressure?
Yeah.
Good. Are they on the move still?
Yes.
Okay. So now that we're all loosened up, we can see here how she's kind of rocking over this way a bit. So already we can see there's some imbalance in the pelvis here. So what we're going to do is first check the legs, and we can see that this left leg here is a little bit shorter than the right one too, and probably some of the orientation of the pelvis there. Yeah. And when you look, you can see that this right foot kind of comes in easier, and this one, whoop, a little bit tight there, right? So what I'm going to do is contact onto your sacrum and pelvis here, and we're going to just do some nice mobilizations to try to even out that pelvis. How's the pressure feel? Good.
Lower back is
Sore. Just let me know if the pressure is too much at all. And so especially into these later weeks of pregnancy, but throughout, a lot of times I utilize mobilizations and manual adjustments with relaxin and the body actually having more mobility than it usually does. It feels good just to kind of mobilize the joints and not put too much force into the body sometimes. Okay. One more round, and then we're going to check where we're at. Good. So we can already see that she's starting to lie a little bit more even, and those heels are almost even. We'll bring this up. We can see here already a little bit better. Can you feel that, Sam?
Yeah.
Good. Good. You can rub right here on mommy, okay? That's going to help to feel better. Thank you for helping. We're going to do one more round here, Sam. There we go. That's a good shift. Good. All right, let's check again here. Look how much more even we are. That's awesome. Okay, so we're going to bring this up here. Perfect. Okay, so mommy, I'm going to work into this part of mommy's back, okay? So we're going to just now do a little bit of gentle rocking here. The boys are probably like, whoa, what's going on? And I always like to check from just the top of the head down to the tailbone, see if there's a nice smooth glide. And this too just already helps to reflexively relax some of the ligaments down in the pelvis and the low back. So we're going to use an arc extend, a couple adjustments through your low back here. Last time here. Excuse me, Ozzy, I'm going to check your mom's feet. That's okay? Thanks. Way better.
Alright, bye. I'll see you soon.
Can you feel that there?
Yeah.
Not too
It's
worried.
starting to light up.
Let up, right? Good. Couple more.
This is good for your democracy too.
Awesome. Okay, so now we're going to do an adjustment through here. I'm actually going to move this pillow for a moment if that's okay. Good there?
Yeah.
All right. And let's take a breath in and let it all out. There goes. Good. Another one breath in and let it all.
Do a plug for your Rhapsody?
Ah, nice. There we go. Good. And then just take a nice breath into the heart. Beautiful. Let it all the way out. Try to bring a little breath into the hand right here. There it is. Nice. And can you feel how you can get even a deeper breath down into the pelvis now? Better, right? Okay, so now you're gonna scoot yourself up in whatever way you can kind of come up onto all fours. Almost here, you can rest your head on the pillow. Okay, Miss Adzi, we're gonna work into your mom's hip a little bit, okay? So this is the glute med in here, and I always like to check that one out because that can pull a lot on the pelvis and low back. And we want to make sure our hips are moving well, not only for labor and delivery, but as we're going through these last few days or weeks, days maybe.
I like days.
So we'll go with days of pregnancy to make sure too that when she goes into labor and delivery that the hips are moving freely, that there's no tension on the spine, and that everything can just drop and fall naturally.
I keep thinking I'm gonna call you when I'm in labor.
I keep thinking you are too, actually. I was thinking about that on the way here. I was like, if you need to call me, I'm there for you. Thank you. There we go. Good, last one. Beautiful. Okay, so then stay here. We're going to do a light adjustment on your side here now. I'm going to bring this one up like this. This is going to come through here. I'm going to scoot you towards you just a little bit. Beautiful. Now, we're going to cross your arms. Let this just fall here, real light. Awesome. Other side.
Maybe.
Maybe. Good.
The rolling over is gonna be
It's harder, right? And then we're going to come through this way. Here. Good. Hold here. Beautiful. Now let's go face up. Then I'm going to check in and say hello to these sweet boys. Are you guys having a party in there? Oh, there's definitely some movement from even where we felt them before. There's another little body part here that's more prominent. Hello.
I'm literally just coasting through seasons.
Okay, so now we're going to find the round ligament. So that's the ligament that goes from your uterus to your pelvis. That's the one if you're getting up really quickly and you kind of feel that tension or that pull. But it's also what helps to, when we can release this, help everything drop and less tension in the belly and the front of the pelvis. So we find that by finding the belly button, the hip, drawing a line kind of right where they intersect. Then you can kind of feel areas of tension, and we just want to give some nice gentle pressure.
Are you trying to go back there?
It's amazing. You're barely pressing, and I can definitely feel that shift.
Right?
I'll be right in, okay?
There we go. That's good. Another one right here. Thanks, Tassie. Awesome. Oh, that's better. And you can see here, this is just fuller now. It's nice. Nice and even. Woo! Hello! So fun.
Watch out, they'll get you. They're not shy.
No, I love it.
Oh, you alright?
That's my favorite.
That's right, you okay?
You okay, sweet girl? Yeah, that's another good move. Ooh, a little guy down here too. Nice one more. Yeah, you can feel they're happy in there. There we go. One more spot right here. Oof. They're swimming all around in there. Having a little dance party. Awesome. Okay, now I'm gonna have I love it. I can see your belly dancing around. Go right through your arms. There it was. Beautiful. Right, then big breath in, feel your belly, feel your babies. Surround yourself, your belly with that light on the inhale, and then exhale, let it all out. Surround you with safety, with love. Healthy delivery. All right, then let's come on up to sit. And the last thing I'm gonna do here is just send a little bit of orthosym up through the neck. There we go. How's that feel as you come up?
Oh my gosh, I'm a new woman.
Awesome. There you go. You are all set.
Thank you so much.
You are so glad
Do I
to.
need to do anything when I leave here, or like,
No,
are
you know,
sensing anything they need?
I think and breath. Yeah, rest and breath, and kind of breathing into them.
Okay. More breathing, more deep
Yep.
breaths. Okay.
And then otherwise, keeping yourself, you want to rest, but like gentle movement throughout the day is important as well, because if you're just sitting or reclined or anything like that, then they're not having that gravity to help pull them down.
Okay.
So you do want to get up and move a little bit. Doing some squats is actually a good thing if you can handle even like 2 to 5 at a time. You know, has support when you do it. But then that way, you know, their gravity is working with you as well as your pelvis is shifting and kind of getting into place.
Okay.
Okay?
Sounds good.